Hi, this is Joseph Pate, better known as Medicare Joe, and today we're going to be explaining the difference between Medicare Supplement Plan F and Medicare Supplement Plan G, so stick around. Hi, welcome back. This is Medicare Joe, and like I had mentioned, today we're going to be talking about Medicare Supplement Plan F versus Medicare Supplement Plan G. At any point during the video, feel free to pause or give me a call in case you have any questions, and don't forget to hit the red subscribe button in the bottom right hand corner. Before we get started, one thing to note that this video being 2020 now, it's probably going to be benefiting most folks that are already on the Plan F and they're looking at Plan G as an alternative. Keep in mind, whenever you're looking to change from one Medicare supplement plan to another, 9 out of 10 times you do have to qualify with your health, meaning you have to be in fairly good health to make the switch. All carriers underwrite differently for certain health conditions, so feel free to call us if you have a specific situation that you'd like to look at. So we're going to take a look at the Medicare supplement policies that one can enroll into. So there's quite a few plans that you can pick when you're on a Medicare supplement policy. And again, these are all standardized plans, meaning that the benefits are the identical same no matter which company you have based on the plan letter that you choose. So a Plan F is a Plan F and a Plan G is a Plan G. Now, F and G are the two most common plans for folks to choose because they cover you the most. They cover those gaps that Medicare is not covering. So let's take a deeper dive into Plan F and Plan G and how the two plans compare. On Plan F, as you can see, everything is covered at 100% as we look down that column. Plan G, very similar, is covered at 100% as well. There's one difference, as we can see here, under the Part B deductible. So the Part B deductible, that's your doctor medical deductible. On Plan F, you can see it's covered at 100%, meaning they pay it for you. On Plan G, it's actually not covered at all. So I put in here $198 to date this video. It's 2020 now. That is the deductible for Part B, meaning that if the insurance company is not going to cover it, that would be your only cost. So again, on Plan F, everything's covered at 100%. Plan G, very similar. One difference is you pay the Part B deductible. So let's take a look and see how this breaks down. As an example, I've used 70-year-old male out of Virginia, non-tobacco user, to pull up some rates for us. So on Plan F, the most affordable rate is $153.28 with Mutual of Omaha. And again, remember with Plan F, there's no co-payments, you don't pay any deductibles, you can use any doctor or hospital that accepts Medicare. On Plan G, the best rate is with Medico. Premium being $114.25. Again, with this plan, no co-payments. You do pay your deductible, again, which is $198. And again, you can use any doctor or hospital that accepts Medicare. So again, the two plans almost identical aside from that one difference. So let's look at this from a numbers standpoint and see how this breaks down. On Plan F, again, Mutual of Omaha, we have their rate. Medico, we have their rate. So the breakdown, Plan F, $153.28, Plan G, $114.25. That's a $39.03 monthly difference between the two plans. Now, if we take that premium and we annualize it over a 12-month window, it gives us $468.36 per year. That is the savings in comparing Plan F and Plan G. So let's look at that one more time here. We have Plan F and we have Plan G. And if we look at the two premium differences, we have $153.28, $114.25. $39.03 monthly difference times 12 months is the annual savings that you would have between Plan F and Plan G. What I'm trying to show you here is the breakdown and where this difference comes from. So we take that difference of $468.36 per year, and the only difference between the two plans is that Part B deductible of $198. So there's actually a net savings in this case with G over F of $270.36 for the year. See, basically the insurance company is charging you what we call a convenience fee to pay that $198 for the year. So with Plan F, it's actually costing you $468.36 for your insurance company to pay this $198 deductible for you. So to my clients, I always raise the question, why would you pay $468 for something that only costs $198? Because that's all the deductible is worth. You're better off paying that on your own and saving this extra money by putting it in your pocket. So that's how the breakdown looks with Plan F and Plan G on a numbers standpoint. Now let's talk about what's happening to Plan F and G after year one. Now, as you know, these insurance policies, they go up every year. You get a rate increase. So the rate increases and the stability is actually based not only on the carriers, but on the plan letter that you have. One thing to note here, as of 2020, Plan F is no longer available to people turning 65. So this video is strictly going to be for folks that may have picked Plan F prior to 2020. They've stopped the sale of people turning 65 as of January 1 from buying the Plan F. They just don't have the option to enroll in it anymore. So let's take a look on how that actually can affect a risk pool. So the risk pool for Plan F, which I'm going to show you here in just a second, it actually becomes unbalanced as the policyholders get older because no younger enrollees can come into the plan. So again, people under 65 as of January 1st, 2020, not on Medicare yet, when they go to sign up, they can't pick the Plan F. So what that creates is a closed aging risk pool. Everybody, if you pictured everybody on the Plan F in one risk pool, can no longer accept younger folks into it, typically healthier folks. So as the policyholders get older on the Plan F and they get sicker, the claims start to increase. And with the Plan F, being that there's no balance now, as the claims increase with no younger, healthy enrollees buying the plan, policyholders have higher rate increases. Premiums start to go up even more. We refer to this as basically the law of large numbers and in shutting off the valve of new enrollees into the plan. And it is thought of as the sinking ship theory. I know it's a little bit dark, but it does play a purpose here. So let's just take a look at what I mean by the sinking ship theory. If you take all of the Plan F policyholders to start off, and now premiums start to increase. So the ship, it's going down, right? A lot of folks get upset when they have their increases. And the healthier people that can qualify through underwriting to go to Plan G, because that's a big part of this, is you have to qualify medically to get onto the G plan, will take the lifeboats to safety and will go on to the Plan G. And now on Plan F, you're going to be stuck with a group of people that can't qualify to get off of the Plan F. Those people are going to go down with the Plan F because they can't change. They can't qualify with their health to get off of it. Now you have a group of folks that have a lot of claims, have too many medical conditions to get off of the plan. So you have a group of unhealthy, not unhealthy, but folks with medical conditions that now can't move. They can't get off of it. So the more claims that are filed, with no balance in the premiums with younger, healthier folks, gives for even more of premium increases. So let's take a look and see how this would look as far as on a scale. So let's say you have Plan F and Plan G. Again, we've brought those premiums up here again, the same example, 153 and 114. And I've put a 15% increase on the Plan F, which is typically where it's at now. It's expected to go up even higher than that. And a 10% increase on the Plan G, which is pretty conservative. Sometimes it's a little bit less. And if we break these numbers down, you can see here on the chart I've done a 10-year forecast. But if we break these numbers down and we look at it on just a 5-year basis. So again, this is if you were to stay with the plan and not change, with a 15% increase over the next 5 years. So let's bring these monthly costs down. In year 5, if you were to stay with Plan F with a 15% increase, your premium would be $308.30 per month. On the Plan G, you're looking at $184 a month. So now that gap in the monthly premium is becoming even more. So now we're up to $124.30 as far as the monthly difference. Times 12 months, if we annualize it again, gives us $1,491 per year. Again, the deductible being $198 per year, now your difference in savings is $1,293. That is the unrealized savings you'd have in this 5-year window if you were to go with G over F. That looks a little bit different now at that point. You're saying, okay, wow, now my $198 deductible, it's actually cost me quite a bit more with Plan F over G by just me paying it on my own. So a lot of questions we get is what happens if the Part B deductible starts to increase? So to do some homework and research for you here, in 2010, that Part B deductible was $155 a year. Again, in 2020, the deductible is $198 per year. So over a 10-year window, it's gone up on an average of less than $5 per year. So that increase hasn't jumped crazy over the last 10 years. We don't expect it to. Now, good question is, well, what if it does? What if that Part B deductible increases to a much higher cost and now you're paying a lot more in that deductible? Let's say it went from $198 to $500. When you're on Plan F, they're paying that deductible for you, but they're building that deductible into your premium. So if the deductible was ever to shoot up from $198 to $500, the rate on Plan F per month would actually adjust accordingly. For example, if it did go up, let's say an extra $300 in this example, 300 divided by 12 months brings us to $25 a month difference. So you can see if you were on Plan F and this ever were to happen, your premium would adjust accordingly. The insurance carrier is not going to foot the bill for that difference for you. So the myth of, well, what happens if that Part B deductible goes up? If it goes up, it's going to go up for you on Plan F as well in your premium because it gets paid one way or another. This brings us to our conclusion. Which plan is the better plan? I mean, there's a few things to consider here. Number one, lower cost. You're going to be paying for insurance no matter what on Plan F and Plan G. On Plan G, you pay less from the beginning. It also brings us to more stability. Like I just went over with you with the rate increases are a lot lower on Plan G, meaning that you're going to have a more stable rate in comparison to Plan F as the years come along here. As far as I always say, trustworthy recommendations, a good thing to consider. An agent's commission is actually based on the monthly premium that you pay. So if I were to sell you a Plan F or a Plan G, it's based on what you're paying in your premium. Since the premium is less on the Plan G, the broker actually makes less money. So why else would someone recommend the Plan G if it wasn't for your best interest? If we're going to get paid less to sell you a G plan, we're really doing it and recommending it out of pure numbers and what makes sense logically at the end of the day. I thank you for watching our video here. If you have any questions or if you're looking for exact quoting, definitely give us a call. The number's posted here. One of our agents can certainly assist you. You can visit our website for more information and videos or email us at info@lakefrontig.com. Don't forget to hit the red subscribe button in the bottom corner here so that way you can stay up to date on videos and different information related to Medicare. Again, signing off, this is Joseph Pate with Lakefront Insurance Group, more commonly known as Medicare Joe. Take care. Bye-bye.